Knee replacement, also called as knee arthroplasty, is a surgical procedure done to resurface the damaged knee by arthritis. Knee replacement implants are the artificial components which resurface the joint for better functioning. So, different classifications are used to understand different implants in knee arthroplasty, out of which main three are according to the number of components replaced, implant design, and implant fixation. Let us understand them one by one. So, first is number of compartments replaced. So, according to the number of compartment replaced, we can define them as unicompartmental, bicompartmental, or tricompartmental. So, in unicompartmental, only medial or lateral joint surface is replaced in knee arthroplasty. In bicompartmental, entire femoral and tibial surfaces are replaced, and tricompartmental, femoral, tibial, and patella surface are replaced. So, as you can see in the given X-rays, they are named according to the medial, unicompartmental, or bicompartmental arthroplasty, and the figure given below, which explains the medial lateral component or the compartments of the implant which are being replaced by the arthroplasty components. So, accordingly, you can identify and classify them as unicompartmental, bi, or tricompartmental knee replacement implants. Next is according to the implant fixation, how the implant has been fixated to the bone. It can be cemented fixation, cementless fixation, or hybrid fixation. In cemented fixation, implants are most commonly held in place with a fast curing bone cement, that is polymethacrylate. And in cementless fixation, implant can also be press fit onto the bone, and this type of fixation relies on new bone growth into the surface of the implant, as it is not been fixated with the cement. And cementless implants are made up of material that attracts new bone growth, example hydroxyapatite. So its main function is to attract new bone growth, and they can be more textured or coated so that the new bone actually grows into the surface of the implant and fixation is better. In hybrid fixation, what they do is for total knee replacement, combination of cemented and cementless fixation is used. So the components can be used accordingly, and they can be called as hybrid fixation. So the next classification of implants is according to the design. It can be of fixed bearing implants or mobile bearing implants. In fixed bearing implants, the design is such that the polyethylene of the tibial component is attached firmly to the metal implant beneath, such that the femoral component then rolls on this cushion surface. But they are fixed and the motion will be limited or restricted. In mobile bearing implants, what this has is a rotating platform. The polyethylene component which is there, this will have a curved surface, and this surface will allow the better range during the knee motion. Let us understand it with the help of diagram. So as you can see, on the left side of the diagram is a fixed bearing design, and on the right side it is a mobile bearing design. In fixed bearing design, the femoral component will have motion with the poly component, but it is not curved, so the motion will be limited. And at the same time, in the mobile bearing design, the poly component is curved, so the femoral and the poly component will have a greater stability along with the mobility and the range of motion. At the same time, poly component will also have some kind of motion with the tibial base, which gives a rotational motion to the implant. So this is how you can differentiate the fixed bearing design with the mobile bearing design of an implant. So next subclassification according to the implant design, that is cruciate retaining design or posterior stabilization design. So whenever there is a severe damage to the knee ligament, that is specifically cruciate ligament, posterior cruciate ligament, which cannot be managed with the surgery, cruciate stabilizing implant is used. As you can see in the left diagram, a posterior stabilization design of an TCAR implant. So the yellow component which will have the post cam mechanism. What does this mean is it will have certain kind of fixation on the femoral component with the polyethylene, that is yellow elevation. With that yellow elevation there will be a certain fixation in the structure only, and this will prevent the hyperextension at the knee joint, which is a main function of by offered by the PCL. So this is how it will help in stabilizing the knee joint. Whereas in PCL retaining design, as you can see on the right hand side, the purple line, which is PCL, is attached to the gray elevation which is on femoral component. The femoral component will have some elevation to which the PCL will be attached and the stabilization is provided. So as you can see on X-ray also, you can identify whether the post-cam mechanism, that is PCL retaining or PCL excising type of surgery has been done, and which type of implant is present on the X-ray. So why do we need to understand is whether the PCL is retained or excised, we can get an idea, and accordingly we can proceed with the physiotherapy rehabilitation.